Welcome to Montgomery Heart and Wellness, and I hope you guys have been having a great Wednesday. My Wednesday's been pretty busy, and today we're going to talk about heart disease. So your doctor walks in and says you've got significant heart disease and you need open heart surgery. And in fact, you need bypass surgery, and we need to operate in the next few days. So what do you do? And what's the reason behind your doctor making that decision? So, we're going to talk about open heart surgery, the indications, and we're going to talk about alternatives that you should always consider all of your options when you're considering something like surgery. So, first and foremost, I'd like to share with you the standard reasons for open heart surgery. What are your doctors thinking? What do we look at when we say, oh, yes, you're a candidate for surgery or you need surgery, etc.? I want to start off with looking at some basic anatomy of the heart. As you know, the heart circulates blood, and the first organ that it circulates blood to is itself. And it has two major arteries. It has one that come off the right, and it has another one that come off the left. And the artery that comes off the left has two major branches. It has a branch that circles around to the back of the heart. We have a funny name. We call it the circumflex. The name is not important. It has a large branch that goes down the front of the heart. It's a left branch that goes anterior. Anterior means front, and it goes down, descending. So we call it the LAD, the left anterior descending artery branch on the left. And this feeds probably about 75% of blood to the heart muscle on the left. And on the right, you have a major branch, and it comes and it usually feeds blood to the bottom of the heart. So basically, you got two major branches or two major arteries, a left artery and a right artery. And the left artery has two major branches, one that circles around to the back and one that goes around the front. And so these are the major arteries to look at. They all have many branches. Here's a little cartoon drawing that simplifies it. Here's the artery on the right. Here's the artery on the left. And notice it has a branch that circles around to the back. And this also has a large branch that goes around the front. And the artery on the right feeds another branch that goes underneath. So it also feeds in the back, but the bottom of the heart. And it's sort of in a mirror image of this one that goes in the front. And so when we look at the heart and we determine whether or not someone needs surgery, the basic determination are the number and types of blockages and the heart function. So first and foremost, if you have a significant narrowing or blockage, as we call it stenosis in the main artery from the left, that's an indication. If you have the equivalent, so maybe the two branches from that main artery have narrowings, we call that a left main equivalent. So that's an indication. So there's decreased flow in the left anterior descending and decreased flow in the left circumflex. That would be an indication. And of course, decreased flow in the left anterior, the main artery in the front, plus two or three other diseased vessels would be an indication. And again, if you had heart failure with at least two or three vessel disease that's significant, that may be an indication. So let's look at the anatomy here. You have the main artery on the left with significant narrowing. That by itself would be an indication, especially if you had symptoms. If you see how these two arteries have narrowing, now this artery here, this narrowing by itself is what we refer to as the widowmaker. So you can see how these two branches are the only outlets for here. So both of these have significant narrowing. It's equivalent to having a narrowing here. That's why we call this left main equivalent. And then you can have a widowmaker plus two or three other vessels with significant narrowings. That may be an indication. And of course, if you have heart failure, that could be an indication you have heart failure with three vessel disease and of course symptoms. Now, the anatomy is not the only thing to consider. What are the other things to consider? You know, there are indications for and against having surgery as well. So just because you have the narrowings, there are certain indications for doing it versus indications for waiting and saying, hey, it's not the right time. And the indication for doing it would be symptoms that are not relieved by medications and potentially not relieved by an angioplasty procedure as well. An indication for not doing surgery would be having health problems that are not likely to improve with surgery. So if you have other health problems, that can make the surgical period complicated. And if these health problems aren't improved by the surgery, then that can make things worse because these health conditions might get worse as a result of surgery. So what are some of the symptoms? First of all, there's chest discomfort. This is an obvious symptom: tightness, heaviness, fullness in the chest, any amount of chest discomfort that limits your ability to walk, limits your ability to carry out your activities of daily living. Shortness of breath, same type of thing. Many people may not have chest discomfort, they have shortness of breath, and also heart failure symptoms, fatigue, swelling, shortness of breath, etc. So these are significant symptoms that if they're not relieved with conservative means, medications, or other procedures, may be indications for moving forward with heart surgery if you're not able to improve your overall quality of life. Other health problems such as diabetes, kidney disease, kidney failure requiring dialysis, lung disease, inflammation, obesity, and other illnesses. These are conditions that can make things worse. So, for example, excuse me, for example, somebody with kidney failure needing dialysis, or if you have significant kidney disease and you haven't gotten to the point where you need dialysis, you may have enough stress on the kidneys during surgery and after surgery to where you may be tipped over into needing dialysis. People with advanced lung disease may have a hard time getting off the ventilator because, again, they have to put you to sleep. The anesthesiologists have to give you drugs to sedate you. And sometimes you can get lung infections or the like. Inflammation can cause things to be worse after surgery, more pain, decreased healing. Obesity always makes surgeries more complicated, as well as potentially other illnesses. So other health conditions, one or more of these other health conditions can complicate things. So even though you may have the anatomical abnormality that would be the indication for surgery, there may be some contraindications that may make you want to do something else instead of moving forward with surgery. What are alternatives? I mean, your doctor comes in and says, well, you need open heart surgery. You should always ask about alternative approaches. And the alternatives we like to use, and we have patients come to us all the time looking for alternatives, first and foremost, nutrition. Now, we utilize a defined plant-based diet. We use it in a prescriptive manner. We place our patients on certain types of nutritional regimen. And an excellent nutritional regimen can help suppress symptoms. It can improve your overall well-being. Even if you have other conditions like high blood pressure or diabetes, these conditions can be controlled or reversed with optimal nutrition. And even heart disease itself can be potentially reversed. ECP therapy, we've been using for more than 2 decades, very helpful for the treatment of chest discomfort, shortness of breath. There have been many individuals we've seen who have been recommended to have heart surgery. They decline. They come with a nutrition program, the ECP therapy. ECP stands for external coronary pulsation. It's a cardio assist treatment. We pump your legs and we improve blood flow to the heart during the relaxation phase of the heart. Chelation therapy is an infusion therapy that helps open up arteries. We've used this successfully in many patients. There's another infusion, a molecule called phosphatidylcholine. It helps to remove plaque from arteries. Then infrared sauna, believe it or not, has lots of scientific data showing its benefit in individuals with cardiovascular disease, both short-term and long-term. And if you have surgery, even if you have surgery, many of these therapies can still be used for individuals who've had surgery, who had gotten fully improved from surgery, or an angioplasty procedure that they hadn't fully improved from. So here's a patient we treated with nutrition. This is the major artery coming off the left. It has a 95%. There's a 95% widowmaker. And she could have had single vessel bypass. We initially recommended, but she wanted to undergo our nutritional detox program, which she did. And she had ECB therapy plus nutritional detox program. And in 5.5 months, it opened up. So from baseline to beginning, 95% went to 0. You can see this left main artery is bigger than here. You can know that compared to the catheter size. So essentially, you had disease here that you weren't aware of, and that went away. And this vessel obviously got better just with nutrition alone, no stent, no bypass, etc. So this is the power of nutrition. You should never underestimate the body's ability to heal itself when properly nourished. So general considerations, making a decision, consider all the options. Usually most situations with bypass surgery, it's not an emergency. If they tell you got to do it tomorrow or else you're going to die, just sort of step back, take a deep breath, ask them to explain why that's the case. Many of these diseases, the narrowings or blockages, if you will, they take years to decades to form. So most of these things don't form overnight. Preparing for surgery, let's say you absolutely have to have surgery, you should improve your nutrition. Let's say surgery is scheduled for 2 weeks. Get on a raw, detox, plant-based diet. That's very helpful for surgery. It reduces inflammation, improve your chance of healing. It also reduces inflammation in the arteries, so it decreases your chance of having a heart attack during surgery, potentially. And always consider an alternative approach. Give it some thought, talk to families, get second opinions, whatever the case may be. It's your heart, it's your life. You should give it strong consideration before making a major decision. So I hope that was quite helpful to you. And of course, I'd like for you to look in our notes section. We have lots of good information about different programs. There's a nutrition detox program that we have, several courses. And of course, take our Heart Strong survey if you haven't. Determine if you have symptoms of heart disease early on. It will give you a score, give you some ideas whether you have symptoms that are signs of early heart disease. You can reach out to us for more information on how to improve your heart condition if you do. So again, thank you for joining us tonight. And those of you who are new to the channel, please subscribe. And of course, hit the likes, give us a thumbs up, hit the likes button. And please share this video because I think it'll be very helpful to many individuals, including loved ones that you may have. So until next time, you guys take care.